I hope it's not what I think it is. I hope I'm wrong.
Yeah.
This is one case I hope I'm wrong. I hope it's something. I hope it's something less.
What's going on, everybody? We got Dr. Mesa from DOS with us here. Doc, I'm going to jump right into it. Zack Wheeler placed on the 15-day IL with right arm blood clot. 15 days. Do you think there's any chance that he's only missing 2 to 3 starts and we'll be back out there for his fourth?
No, I think this is a pretty significant injury. I mean, they're kind of downplaying it, but this is something that we see in throwers. I think, and I'm just going on what they tell us. I think what he has is a clot in his arm due to something called thoracic outlet syndrome. So thoracic outlet syndrome, you can see in a variety of people, but it's common in throwing athletes, and we see it a lot in Major League Baseball players. And essentially, there's 3 kinds. One is, so what we're talking about, thoracic outlet, is at the neck. Over here is a place called the scalene triangle where the muscles are. So the nerves and the arteries and veins come out of your neck. They can get compressed here. They can also get compressed under the clavicle or between the clavicle and the first rib, or they can get compressed under the pec muscle, the pec minor. So there's 3 areas, and there's 3 things that essentially can be compressed. One, and the most common, is the nerves. Neurogenic or nerve-related thoracic outlet syndrome is by far the most common variant. However, you can also get arterial, which is compression of the artery, or venous, which is compression of the vein. Now, when they're reporting that he has a venous clot, you probably should assume that this is a venous thoracic outlet syndrome, which is way less common. So it presents kind of like Wheeler presented, with some heaviness in the arm, some vague pain, some discomfort. And as it progresses, you can start to see some, prominence of the veins, even swelling. But the fact that they had a clot tells us this is probably venous in origin. And the reason for it is twofold, most likely. One is, his mechanics. I mean, he throws a ball multiple times, and that's repetitive trauma to the vein. And the vein essentially gets compressed in some part of the throwing cycle. And you can almost see, if you watched him closely, how his performance, and people are saying something's off with him, something's off with him. They originally thought it was the shoulder. That was negative. And now, they found out probably through an ultrasound that there's a clot there. So the question remains, well, what do you do when you have a player that has a clot in their vein? Well, first thing you want to do is you want to try to put them on anticoagulants so the clot doesn't get worse. And also you want to, if you can, break up that clot, do what's called a thrombectomy, or removal of the clot. And that's part of the treatment. Another part, unfortunately, may be surgical to decrease the compression that's there, which may be a rib resection. It happens, and it's unfortunate because that would mean most likely end of the season, and it's probably about a 10-month recovery if that is what it is. And this is just assuming that that's what the injury is. He may not have it that severe. He may be treated with just rest and thrombolysis. But I think that they're trying to get the experts to look at it a little bit closer and see what extent this involves and how far they have to go. But the good news is, if it is that bad and he requires a first rib resection, the recovery, I said, is 10 months. The return to sport is over 80%, which is good. And they pitch better after the surgery on average, and they pitch as long career-wise. And some famous pitchers have had this and gone back. Josh Beckett, Strasburg, and even Weston Wilson had thoracic outlet. So it's out there. It's not a common phenomenon, but it is more common in baseball players because of the repetitive throwing mechanics.
Yeah.
And it's just a wait and see. I'm totally speculating just based on the diagnosis, but when I hear a clot in the upper extremity in a throwing athlete in their dominant arm, that's the first thing I think about.
Obviously not what you want to hear. I mean, we got Nola coming back from IR tomorrow, so we do have another arm there. But I mean, Zack Wheeler has been arguably one of the greatest free agent pickups in Philadelphia starting pitching history. Doc, when it comes to a clot like that, how long do you think he could have been dealing with this? I mean, he's been struggling since post All-Star break. Is there any chance that he's been having it for a significant amount of time? Because obviously, a clot like that causing a lack of blood circulation in your throwing arm is going to be pretty dangerous the longer that you have it in there. And so that obviously would lend to that longer recovery. But wouldn't it be pretty dangerous if he's had it for a significant amount of time?
Yeah, I mean, I think on average, the presentation is probably about a month and a half, how long it takes to get to that level. And the thing is, with the clot, there is a lot of collateral circulation. So even though there may be a significant clot in the vein, there is still some ability for the blood circulation to get through. And that's why initially the symptoms are fairly vague. They're not like can't throw. It's more like the arm feels heavy, the mechanics start to ache a little bit, and that's why it takes a little bit of time. But like I said, it takes, on average, it probably takes a month and a half, 2 months before people even figure out what's going on.
Yeah, I mean, I've talked to people that have had, blood clots in their thigh and everything, and they say it's extremely painful.
Yeah.
Is that something that you typically experience with these thoracic outlet clots? Or is it just the fact that he has that heaviness, just something feels
Yeah.
off, but you really can't tell? You just think, hey, I've thrown tens of thousands of pitches. We're pretty late into the season. Maybe I just am a little bit tired, and then they kind of get a little bit deeper as the vein and clot gets worse.
I don't think it's particularly painful in the sense that I think more, even thoracic outlet that I've seen that's neurogenic, which is more common, is very like slow. People just notice certain symptoms. Their hand feels numb. They get tingling. I think the vascular, it's more for venous, it's more heavy. The arterial one is more significant. That will give more intense symptoms, but it's very, very rare to get that. I think that the two classes of people that get these clots are the athlete on one hand, and then they get people that are having they have catheters and stuff in the catheter clots. But I think in this instance, I don't think it's excruciatingly painful. I think he's been dealing with this probably for a couple months, and it just got to the point. I mean, how long ago talking about shoulder pain, you watched him, he wasn't pitching right. They got the MRI. The MRI was clean, and it would be because you won't necessarily see a clot on an MRI, particularly in the subclavian area, which is up here. So I think that they had to get more studies. I think that he just kept having some symptoms. He still looked off. I think they eventually got to getting an ultrasound or some other diagnostic test that showed what was going on.
So with a 10-month recovery, you said a little bit longer return to play. I mean, there's a significant chance that he's missing, if this is in fact the diagnosis. I understand,
Correct.
with your expert opinion based on the limited knowledge we do have and your experience in treating stuff like this. If that is the case, I mean, there's a chance he's missing the first 2/3, 3/4 of next year.
Yeah, if he actually has to, and the surgery is typically what's called a first rib resection, because you're getting the vein is getting pinched between the collarbone and the first rib. So what they do surgically is the vascular surgeon typically removes the first rib, and that decreases the pressure, because even if you clean out the clot, you're not eliminating the pressure in there. Now, if it's very acute and relatively small, they can try doing it, like I said before, with the thrombectomy and anticoagulation, and that would be a much lesser course. But, in all honesty, if that is indeed what he's dealing with, probably the best thing is to do the actual surgery. And again, this is just based on a release that he had a clot in his upper extremity. So this could be something completely different, but this is what I think may be going on with him.
And then, Doc, I know this isn't really your expertise as far as managing ILs and baseball teams, but the fact that they put him on a 15-day, is that just, hey, we're waiting on some more tests? It very well could be something where it's a season ending. Let's just put him on 15 before we're 100% sure that we have to shelf him. Or is there any kind of sign for hope that, hey, it's just a 15-day IL? Maybe we'll see him back in September.
Well, that's the thing. I mean, I think what you're buying yourself is time to get more opinions. I mean, this is not a common thing. I'm sure a lot of people have never even heard of this condition, except for maybe Markel Fultz back in the day. But I think that this is something that probably needs a few people to talk about before they make a final decision. And it's a very significant decision. So I think that 15-day is trying to say, okay, and like I said before, maybe this is something not as severe as I think it is. And maybe they can say, oh, we rest him, we put him on some medicine, we break up the clot and move on.
Now, Doc, is there any specific part of the country that is known, well known for treating this kind of thing, where if we hear, hey, Zack Wheeler heading over to this area for an opinion, that we can be like, oh, geez, like that's not good.
Yeah.
They're the specialist, the foremost specialist in, rib resection or or anything like that? Or is it just, hey, well, let's wait and see?
Well, I think we're lucky that we are in the East Coast because he can go to Hopkins, he can go up to New York, he can go to Philadelphia even, and they're great experts in this condition in all those areas. John Hopkins has great specialists. The University of Penn and Jefferson do, and even in New York. So you can kind of fly under the radar. He won't get. It's not like he'll get flown to Birmingham and see.
Yeah.
I don't think there is a. And again, this is due to It's due to the rarity of this and and the fact that this is kind of something that flies under the radar a lot. I mean, if I heard that he was going to the Mayo Clinic in Minnesota, I'd be a little concerned, or even going up to Harvard, but I think they can kind of keep that on the down low. But I think it's worth, it's a serious thing. And depending on what the treatment is, you want to get the diagnosis correct, especially for him. And you want to make sure that the treatment is appropriate.
Well, Doc, I mean, we've been partnered up with TOS for years now, and we love these segments. Obviously, the news isn't great, but this has got to be one of the most interesting segments that we've been able to have with you, and the level of knowledge that you're able to share with this is incredible. So I really appreciate your time and your knowledge in this. I mean, look, fingers crossed that it's not like that. And I guess the next question is, what's the best case? I mean, you hear blood clot in the throwing arm. Is there any scenario in which that isn't a long-term or season-ending injury? I mean, to me, that screams like that's a terrible, serious thing, even if it's not that worst case. I guess what's the best case? And then is this technically the worst case?
Well, the best case would be, you talk about a clot. They weren't specific about location. And if it was, down in the arm or a different area, you can treat that relatively conservatively, get rid of the clot and move on. But based on this diagnosis and the worst case scenario is what we talked about is a vascular thoracic outlet syndrome with a clot, which needs to be addressed. And in all fairness, they've gotten a lot better. Vascular surgeons got a lot better about putting things in there. Like they open up the clot, they put little balloons in there. So it's not a real surgical thing. But the problem is, even if you were to put like a stent, like you do in the heart, put a stent in there to prevent this clot from forming, the pressure doesn't change. So that's the real bugaboo is, does he need to have this operation? And that's probably why he's going to travel around if it's truly thoracic outlet syndrome, to see if that's really necessary.
Well, Doc, again, I can't thank you enough. We're going to be keeping a close eye on this. I'm sure we're going to talk about it again, either whether they confirm this diagnosis or whether we get a little more information about the specifics of what he is dealing with. But it sounds like could be, a very, very significant thing. I mean, we've mentioned on the podcast, Rangers struggling, but, as long as they make it in the postseason, he's going to be a lefty out of the bullpen. You'll lose Alvarado, but you get Ranger to add to the bullpen. All right, Nola's coming back. We don't know exactly what he's doing, but Taijuan Walker has really been pitching a lot better this season. I mean, it just changes everything. Who's your 1, 2, 3 starters for the postseason? Is Ranger able to go to the bullpen, or is he now going to be relied on? Are you really going to have to force Painter up here, even if he's still struggling a little bit in AAA? So, I mean, we're going to talk a lot more about that once we get a better idea of what we're looking at with Wheeler. But I mean, my head's spinning based on all of this, on just what this means for the rest of the season, what this means for our starting pitching rotation. It's just throwing everything for a loop.
Yeah, and in all fairness, I have not diagnosed him, not examined him, not seen any of his studies. I'm just going with what they tell us. And if they tell us this, I mean, I don't think they would say a clot in the arm unless there was a clot in the arm. And it pricks certain people's ears up when they hear that. And I think they're relying on the fact that a lot of people don't know what the significance of that is, So I think they're trying to buy themselves some time. We'll see. Hopefully, I wish the best for Zack, personally and professionally. I hope it's not what I think it is. I hope I'm wrong.
Yeah.
This is one case I hope I'm wrong. I hope it's something I hope it's something less. All of us do, but we just got to call it like we see it.
No, incredible stuff, Doc. I really appreciate it.
Oh, no problem. No problem.